everyone. We are so excited to have you guys here today with us. I just want to give you guys a quick overview about us and about what we do. I know some of you know me, some of you know that I am from Germany. As you guys know, Plasma was founded in Germany and was later further developed in Italy, where our machine is manufactured. Coming from the plasma industry so many years, I can only say that I am so grateful to work with the Plexr and with Met Results, because our Plexr is, in fact, the only equipment in the market that basically operates on pure plasma energy. And we're going to get into details about what pure plasma is and about what basically our Plexr can do for you and your business. And yeah, if Arash, if you want to get into those details.
So I just want to say hi to everyone. Dr. Croley, thank you for joining us tonight. I
Yeah,
know that
you're welcome. Always a pleasure to be here.
for today, we're going to talk about, as summer is coming, we're going to talk about what's happening basically in the aesthetic industry during the summer and what are the needs, what are the considerations and everything. So, Dr. Crowley, my first question is, what are basically the challenge when it comes to summer? And yeah.
Yeah, I mean, that's, I think an issue many of us face in the aesthetic industry. Obviously, practicing in Florida, on the coast of Florida, I deal with this quite frequently. So my patients are wanting treatment year round. However, we have unique challenges during large portions of the year. Southern Florida is year round, and kind of where I am, we only have a few months of, kind of cooler weather. We really don't have a true winter per se. So, and those, spring to, through the summer and early fall for sure, we have to be really careful with our energy-based devices and the types of treatments we provide to the patients. Most notably when we treat patients who are either getting sun exposure or have sun tanned or sunburned skin, we increase the chance of adverse outcomes. Specifically in this arena, we're talking mostly about pigment changes. And so we increase our chance of post-inflammatory hyperpigmentation, or PIH. And we can also hypopigment areas. And so it really limits a lot of the device choices that we have, to offer our patients during big portions of the year. And so, in the old days, so, more than a decade ago, we had just a CO2 laser. That was the first device we bought for our practice. And we basically blocked out around 6 months of the year that we didn't even offer the treatment at all. So we kind of had a device that sit in the closet that we couldn't even use, because regardless of how much we really coached and instructed our patients to avoid sun, it was nearly impossible. Just the day-to-day getting out and going to the grocery store and the part of the country that we live, they would get a significant amount of UV exposure. And we would increase the chance of then having to manage these pigment issues for months afterwards. And we dealt with that. And I got, kind of familiar with dealing with some of those things. But it was a challenge. And so we decided it would be easier just not to offer some of the devices for big portions of the year in the area where we live. Now, what we know is that regardless if you live in one of these areas or if you're, living somewhere in a more northern climate, we still have these concerns during maybe shorter times of the year when it's summer, but we deal with it year round in Northern America, and you're going to deal with it worldwide because you're going to have patients traveling to some of these areas. And so it was really nice to see devices come onto the market that we could use year round. So things that we could use in our practice that helped us address a lot of skin textural issues, pigment issues, lifting and rejuvenating, kind of things that all patients are searching for, and that we could do that year round. We weren't limited to a specific time frame that we could do those treatments.
Absolutely. One of the things that, it's important to me because during the summer, you have the most basically sun and other factors which damage your collagen. So if someone really, like these days, the new trend is not do one treatment and then bye-bye, I see you next year. People want to do less aggressive treatments, but they want to do it constantly, like every other month, every 3 months. So they want to keep their collagen basically bases and their construction, rejuvenative basically power of the skin. Now, when it comes to summer, because of the sun exposure and heat, you need to take care of your skin more than other time of the year. And you face with this idea of lack of basically, let's say, safe technologies to use it, you know? Okay, so let's move to the other slide. Now, what are these benefits? If you want to go.
Sure. So, again, we can talk about Plexr. You guys know that I think I recognize some of the names on the call. Some people are new. But if you're, follow along on my social media or some of the things that Arash is posting, you see that I use the Plexr, and we use it pretty extensively in our practice, and we use it in various ways. So we have our estheticians that will use this in a nano-ablative or non-ablative way monthly on some patients who are coming in getting things like the Plexr shower. We have a semi-ablative way that we're using this, like our cat resurfacing technique, and we're going to really talk a lot more about that in the rest of the webinar today. But we also have the ablative form where we're actually sublimating or removing excess tissue, and that's something that really this is one of the few devices that we can do that with in the med spa setting. So our non-invasive or minimally invasive upper blepharoplasties, neck lifts, treating those aggressive perioral lines. We can do that in a very ablative fashion. That is something when I do that, I'm a little more cautious with in the summer months, but it's not something that I avoid altogether. But where I see really, Plexr shining in the summer months is when we're doing our cat resurfacing technique or our shower, because I really don't worry about that much at all, because it's no downtime. It's a very fast recovery. It's things that we can use. I continue to use our sunscreen, and I believe we have some photos or some slides, or I know we have some pictures that we can share that we show day 1, day 3, what that recovery process looks like. So what we're doing with this is we're using this technology to deliver plasma energy specifically. So, plasma is a form of energy. For those of you who are not familiar with Plexr, what we're doing is we're using a device that's going to basically create plasma energy from the surrounding air. If you think about what is plasma energy, this is the type of energy that you would have like in the sun. So that's a big ball of plasma with energy. So we're able to use the Plexr device to actually create this plasma energy. So we're doing that, and it's going to deliver this. The tissue will go straight from a solid state to a gas state. So we're skipping over. We're not heating a lot of the tissue around it, so we're not getting the thermal damage that we would associate with a lot of the other type of laser devices. So when we talk about, things like removing tissue with like a CO2 laser, we get a lot of thermal damage or heat damage around the area that we're delivering that laser beam. And so although the results can be very effective, that is concerning, especially if we're doing this during times where patients may be getting excessive UV exposure or photo damage from the sun, such in the summer months. Because of that, we know that sun exposure, UV exposure, it activates the melanocytes. So melanocytes are more superficial than a lot of these areas that we're working on. And that's going to, if they're stimulated already from the sun or from UV, and now we deliver some sort of thermal damage or heat damage to that area, it's going to really activate them, and our chance of post-inflammatory hyperpigmentation is high. So with the Plexr, by using this plasma energy, we're actually, if we're going to remove tissue, we're turning immediately to this, we're sublimating it or removing it. If we're using a laser energy, we're actually vaporizing it. So it goes through kind of a heat process or a steam process, and it vaporizes. So that tissue around it is really heated up. And then when we're sublimating it with the plasma, we're actually removing portions of this upper part of the skin without creating that thermal injury zone that we would have with laser devices. So that's how we can use it in the summer months. When we're using this, and why I think in my summer lift protocol that we use in Skin and Tonic frequently, is we're using a cat resurfacing technique. And this is where we're not going to fully ablate or remove the tissue. This is basically a minimally ablative or semi-ablative procedure that we're using. And we're going to take the same plasma energy and we scratch across the surface of the skin, and it's called cat resurfacing. It literally looks like a cat to scratch your face. So I know Sienna has her cats there with her today, but those are very calm, loving cats. Makes me want to pet them. So when we talk about cat scratching your face, it sounds a little bit aggressive, but it's really not. It's something that is really minimally ablative. And we're going to use this scratching technique where we're delivering this plasma energy across the skin surface. And we can go over an area that needs more aggressive treatment. So if we have a really deep line or deep wrinkle and we don't want to be ablative with that because of the time of the year that we're in, we can scratch over it a little bit more aggressively. But because we're not fully ablating that tissue, the recovery time is minimal. So really like 1 to 3 days at most that it's a little bit red. And by doing this and delivering this plasma energy, so with the device alone, we're going to talk a little bit later about the products that we're going to use with it. But if we didn't use any product at all, the plasma energy is going to stimulate those fibroblasts to start making more collagen and more elastin. And as Arash alluded to in the first part of this webinar, that's something that we're all losing as we age. So we know that you start to have collagen losses early as you're early to mid 20s, and it continues. You lose more every year as we advance in our decades. So there's a lot of talk now, and a big, kind of buzz term in aesthetics is talking about collagen preservation. There's, kind of some hot topics about collagen banking, or how do we do things to stimulate our collagen production more continually rather than waiting till everything is we've had such severe loss of collagen and elastin that we have severe drooping hollowness, and we're having to do more aggressive treatments to reverse that, and maybe even sometimes surgery. So how do we lift? How do we stimulate collagen? How do we resurface the skin? So deal with texture, pigment, etc. And the Plexr gives us an ability to do that with this fractional cat resurfacing technique that you see on the screen right now. So you'll see that this is something where we're just kind of moving this tip. It's a more focused tip, so we're able to kind of focus that energy. So if any of you guys seen the shower, that's a bit wider tip. This is a more focused tip, and we're able to move this and scratch across the face. And you see that we're doing that in a crosshatch fashion. So it's going horizontal. Now it's being moved up and down vertically. And that's semi-ablative, but that's stimulating all the fibroblast in those areas. So that's going to turn a little bit red. You're going to get a few darker spots on there, and that's going to flake off within 1 to 3 days. You can see this patient here immediately afterwards, 1 day afterwards, a few days afterwards, a week afterwards. And look at the before and after that you see on the bottom. So you see the before on the left side of the screen there, and then 1 week afterwards, you notice there's just a nice glow with a lot of smoothness. Now, what you don't see at 1 week that really is where this lifting principle comes in is going to be your 3 months, right? And so we know that after a week, the skin looks great. It's tight, it has a glow, it appears smooth. But those fibroblasts that we've stimulated probably are going to have their maximum collagen output after this treatment somewhere around 6 weeks. And so as we stimulate more collagen and elastin production, you will get gradual tightening and lifting of the skin. And so that's really where the beauty of this technique comes in, that we can use this year round.
Yeah, absolutely. So just a quick basically point about what is plasma and what is the fractional plasma. So I have few slides here. Number one, as Dr. Croley said, Plexr generates plasma, and plasma is this forced state of matter. So we have solid, we have liquid, we have gas, and we have plasma. So we are not generating any form of energy. We are turning basically nitrogen of the air from gas state to plasma state. Like our planet Earth is in solid state while the sun is in the state of plasma. So basically we're making a small bolt of plasma or a small sun on top of the skin. And then this is what sublimates the tissue or removes the tissue. Now, when it comes to cat resurfacing, this is the pattern of fractional laser. So we go dot by dot, and instead of removing the whole whole skin, which causes lots of basically trauma, we try to be less aggressive, less invasive. So turning from CO2 laser to fractional CO2 laser or erbium, it's going to be look like that. Now with Plexr, the fractional Plexr, instead of dots, we basically draw lines as you see here. So when you draw lines, it covers more and it is more effective. That's why usually one session of cat resurfacing, which is fractional Plexr, is equal to 3 to 5 sessions of any fractional lasers. The other thing is, as you see here, we don't have any eye shield because it's 100% safe. So there is no risk for eye or anything like that. You can use Plexr for removing lesions from ocular surface like pterygium. I will show you some pictures. So it is very safe for the skin. And you can treat upper eyelid, lower eyelid at the same time, or the whole face and nose and everywhere. You can also treat the lips themselves for lip rejuvenation, which is also a very trendy and new protocol. You can treat neck, horizontal lines. Now, the next question that comes up, Dr. Croley, is when should someone do cat surfacing?
Really, at any time that they see that they're having textural issues, that they're starting to see a little bit of tissue sagging, that they want a lift. So we can go more aggressive or more ablative to get a more significant lift in a shorter period of time if we go with the ablative method. But with the cat resurfacing technique, really, we can do this at any stage. I find that this is ideally suited, if you just ask me where that it fits most appropriately, is going to be in our patients that are probably somewhere in the, 35 to 40-year-old range, maybe up to the 60 age range. But we can use this in younger patients if they have some textural issues, if they have some kind of minimal scarring, like acne scarring or some kind of textural issues. We can use this in a series to help treat that. And we can use it in our older patients to create a lift as well if they don't have that the days that they need in terms of a social downtime that we would do with our ablative. So we can really use it for all ages, all skin types. But if you want to, just who is most ideally suited for this, I would say it's my, 40-ish-year-old to 60-year-old patient that's wanting a skin glow, better collagen production, and a mild lift.
Amazing. So there is another basically viewpoint, let's say that we have when it comes to skin rejuvenation. I'd love to bring this up here to basically talk about.
So as Arash is bringing it up when he says there's another viewpoint, I never know if he's going to disagree with me or not. You guys, we don't plan these. These are live with me and Arash. So sometimes they don't always. We have a little bit different viewpoint, but I always love it if somebody disagrees because then it gives a lively discussion.
Absolutely, but now it's just a different viewpoint, So as you said, you can use cat resurfacing for different ages, and that's totally fine. With Plexr, as you know, we have 3 different modalities. So we have nano-ablative, which is Plexr shower. We have cat resurfacing, which is the fractional semi-ablative, and then we have the ablative. Now, the cool thing about this this idea, and this is actually something new for me. I'm working on this concept for the past year. And it came to me from a friend of mine who is 62 years old now. And she got a CO2 laser treatment about 15 years back. And the reason why she got a CO2 laser treatment, she had a nevus here, and then the dermatologist said that it is a precancerous after the lab test. So to avoid more basically precancerous moles, they decided to do a basically whole face, neck, decollete, and hand CO2 laser resurfacing. And very aggressive. And she was suffering from it for the next 6 months after the surgery, after basically the CO2 laser resurfacing. But the thing is, she says that I never got back to my normal skin. My skin had a better texture, it was more firm, and using CO2 laser destroyed my skin. Now, I don't want to talk bad about CO2 laser at all. I love the technology. I was one of the people who basically started using CO2 laser. Like my first CO2 laser was 1997. So, but the thing is, when you use aggressive technologies, ablative technologies, you are basically consuming the collagen that your skin has. And from all type of different collagen that I think we have over 27 different collagen types. You burn them, you ablate them all, you burn them all, and the main basically recovered collagen is type 1, 2, and 3. So you're losing your natural collagen, you're replacing it with just basically selected type of collagen. And that's why you are improving, but at the cost of losing. Now, instead of doing that, the new strategy that we have is, instead of ablating, use the less aggressive, basically, technology. So the first one is the nano-ablative. So we use Plexr shower. So without removing any skin, using the Plexr shower, we are activating the collagen production. So I don't know if we lost Dr. Croley.
It looks like we did lose him. I'm
Yeah,
sure he'll be right back.
Okay, we'll wait a little bit. Because, otherwise I have to repeat that.
While we're waiting for him, we have a question real quick. Can you
Yeah.
go over the machine settings and time for areas for cat resurfacing? Is there a protocol similar to the shower?
Absolutely. Absolutely. Here you go. So for the cat resurfacing, first of all, these are the some of the suggested indications. You can have face resurfacing, neck resurfacing, hand resurfacing, genital, and these are the suggested price: knee, abdomen, underarm, hair restoration, décolleté, breast, and lip rejuvenation. Okay. Now, there are 10 steps to do cat resurfacing. Number one, you have to clean the skin. It's very important to clean your skin properly. Then you disinfect your skin using a 4x4 and alcohol. Then you take a before picture. It's very important to have basically cool pictures, at least 5 pictures from different angles. Then you numb the skin. You use the basically 23% of lidocaine and 7% of tetracaine for it. You can also do like 5 minutes of Plexr shower to emphasize the numbing. So we have a technique with Plexr shower which opens the skin. It's like a no-needle mesotherapy. And then when you apply the numbing cream on top of it, it will be absorbed quickly and deeply. So this is your numbing cream formulation. And then you wrap it. You wait for 30 to 45 minutes. Now, you divide your face to 10 different areas, like each side 5 area, as you see here. You can have 2 techniques. You can be slow and focused, as you see here, or you can be fast and superficial. So there are 2 basically different techniques for cat resurfacing. Now, this video is, here you go. You watch this. So this is the slow and focused. So you're going to go deeper. And this is fast and superficial. You're going to be more superficial. Healing is faster here. Then we have different protocols for cat resurfacing. If you want to do it solo, then it's going to be 2 or 3 sessions, 1 or 2 months interval. And that's enough for a year or 2. If you want to mix it with other different protocols, then you can basically, the first session, you can go rock start to it. Now, let me go back to the conversation we had before we lose Dr. Croley. We were waiting for you.
Yeah, sorry, I don't know. I mean,
Oh, that's fine. That's fine. We know that you are basically not in a standard setting.
no, I'm in the high speed internet at the Win, right? It's
No,
supposed to be
okay.
supposed to be the best. So I don't know why
That's the means problem. So I was saying that instead of using ablative technology, because if I come to you basically seeking skin rejuvenation, it means that I lack collagen. I don't have enough collagen, right? So when you use CO2 laser or even Plexr ablative modality to remove my skin, I'm losing more collagen, hoping that my body can recover from it. Now, the new technique is let's use the basically nano-ablative technology like Plexr shower. Instead of removing the skin, let's just improving the skin. So we generate more collagen and elastin. And I will show you later on how much effective is basically these procedures to produce more collagen. Now, we build collagen and we wait for about 2 months, you know. So 2 months after the first Plexr shower, we build lots of collagen. We can build our next training on top of this first collagen that we built it ourselves. So we are increasing the collagen, basically, structure of the skin. Then we go to cat resurfacing. So with cat resurfacing, we are removing a little bit of the skin. We are kind of semi-ablative, and we are ablating from the collagen that we built before. And then we wait for about 2-3 months or 4 months. So in this next 4 months, because of the semi-ablative treatment, we are producing even more collagen. And then 6 months after, if it is needed and the patient still is looking for more improvement and more improvements, then we take them to ablative. So when you are in ablative, basically a step, you are not basically consuming or burning the collagen, which is not sufficient. You are basically using the collagen that you build yourself. And that's how you improve the skin.
Yeah. So
What do you
actually,
think
I
about
mean,
this?
we're on the same page there. It's not a different viewpoint at all. Now that I hear you say it like that, that is kind of how we approach it. The way I explained it was more kind of in the decades of life, and but it's a similar principle. In our 20s and 30s, we have more collagen naturally available. That if we do more aggressive treatments, that we're going to be able to recover from that. But regardless, if we do an aggressive, any of the aggressive lasers, a CO2 laser, we are destroying a lot of that collagen. But the younger we are when we do that, the quicker likely that we can recover from that. So if I have somebody, for instance, in their late 20s, early 30s, that has, severe acne scarring, and we're not doing this for just rejuvenation or for lifting, I can be aggressive with the CO2 and they're going to recover from that fairly quickly. But if I do an aggressive treatment like that on my 60 or 70-year-old patient, I'm destroying a lot of their collagen. And although the long-term result, maybe we'll get a good result, but we are depending exactly on what you said. We're kind of, gambling that they're going to be able to make more collagen than what we're destroying in the process. And it may be a longer recovery, as you said in your friend, up to, 6 months or so to get there. And we don't really have to do that. Now, in our practice, we use a membership-based, I have a membership-based program. Many of you guys have that. But any of you that have had conversations with me, very much know that really kind of the basis of our membership is around biostimulation and some sort of collagen production. And so I actually, kind of agree with you totally that if we're going to optimize somebody for these treatments, if we do something to stimulate their collagen before we do these more ablative treatments, they're going to have a better result. And so, long before I had the Plexr, I was doing this with other, sorts of devices. So I would do things like with a series of maybe microneedling before I would do something more aggressive. So with the idea that I'm trying to build collagen and get their collagen optimal before I do something more aggressive or ablative. Now that I have the Plexr and since we've had it, and some of my other devices, you'll see I do a lot of combination therapy. So I'm doing PRP or exosomes or, the injectables, the dilute radius or Sculptra. Or if you have the Plexr device, you can do the Plexr shower. So things that you're doing to stimulate collagen production, and we're building them and preparing them for the more aggressive treatments that we're going to do. So actually, I think we're on the same, page there. So a lot of what we're doing with our cat resurfacing or even our more ablative, we're having to really optimize their collagen production. And in addition to that, there's a lot of things I do, patient preparation. So their nutritional status, if they're a smoker or not, if we can give them,
Important.
supplements to help improve their collagen production. We're doing all that to get them ready. But I think the take home point I wanted to make about the Plexr and the cat resurfacing is I can do that without any preparation at all. I may not get the most optimal results quickly, but with the cat resurfacing, we can really do this safely. We may need to do more of them closer together. If I have somebody that's older and I haven't prepared for that, and they have some big event coming up or something, and we're on a time crunch, and I can safely do that, and I can do it year round. And so, but if ideally they're coming in and they're saying, we just want a little bit of a lift, we want to start this process rejuvenated, then I'm probably going to do the protocol like you talked about, where I start doing them with the shower first to prepare them. So as we do the more semi-ablative or fully ablative procedures, that they're going to have a better result and get to that result quicker after the treatment.
Exactly. So here I have like three basically suggested combination protocols for cat resurfacing. Number one, you can start with Rockstar treatment, which is the nano-ablative Plexr shower treatment. And then after months, you can do cat resurfacing. And then after like 2 months, you can do soft surgery technique, which is ablative Plexr treatment. The second one, you can start with cat resurfacing. So like the second patient, probably she's at her maybe 40, 50s, and the first one is like 60, 70s. So cat resurfacing first, you can do another cat resurfacing, and then do the Rockstar treatment at the end, like as a maintenance. So now we have three different handpieces with Plexr. We have the green handpiece, which has 1 watt power, and then we have the white one, which is 0.7, and we have the red one, which is 2 watts. So you can use any of these handpieces for cat resurfacing. If you want to heal very quick, like if you want the healing in about 3 days, then you use the green handpiece. If you want the maximum result, then you can use the red handpiece or green handpiece for that. I have a interesting slides about hair growth. I don't know if you want to talk about this.
And we
We
can talk
have
a little
two
bit about it.
questions, you guys.
We have some questions.
Yes, we have two questions. One person wants to know what the difference is between the Plexr and the plasma pen.
Mhm.
And the other one, I'm not sure the term sublimation applies to the interaction of plasma with tissue.
Okay.
I mean, I'll take a shot at that, Arash. You jump in if you kind of have something different.
Go ahead.
But when we sublimate something, we're turning it from one state to another. So from a solid state to a gas state without going through the liquid phase. And so we're talking about in this specific example, we're using plasma that's generated from the device. So we're generating plasma that's interacting with a solid state, the tissue, like an upper eyelid or a neck, and we're turning that tissue immediately to the gas state. We're not going through a liquid phase like we would be if we were using a laser where we're heating up that tissue in some way. And that we usually do go through, we're having like steam or something generated to destroy or vaporize the tissue. And in this case, we're going to sublimate it. So we're turning it from a solid to a gaseous state. That tissue is then removed. And because of that, we're getting minimal thermal damage around that area. So Arash,
Completely right. And I made this slide to make it simple for people to understand. If you have a log and you're using a laser, you end up having a charcoal. So the tissue is there, but it's burned. But basically what happens here that you denaturate the protein, and also you take the water out of the tissue. And that's why the charcoal is basically lighter than the wood. Now, from the other side, sublimation, which is turning the solid to gas without turning it to liquid first, it removes everything. So your log will be disappeared when you use plasma. You don't have a log anymore. It's totally gone. And the reason why it's happening, because the temperature of plasma starts from 20,000 Celsius. For laser, like CO2 laser goes up to 500, it goes up to 300 Celsius when it basically attack the skin. Now, 300 compared to 20,000. To have the sublimation, you need to have really dense and high temperature. Now, from here, I can answer also what is the difference between plasma pen and Plexr. So plasma pen mostly is just a marketing name. So I'm going to divide that for for better understanding to two different parts. Number one, fake plasma pens, so-called plasma pens. Number two, true plasmas. So 99.9% of everything that in the market you hear as a plasma pen, they do not generate any plasma. They are low frequency electrocautery device, and you can find them on Amazon for $15. And we had an experiment once, and I have the video, which we basically got a device claiming I'm made in Germany, and it was like, at that time, it is like 15 years back, it was like about $10,000. So the device was very similar to one of the devices that we knew from basically Amazon. So our technical department, they purchased one from Amazon, and we had one of this device. We opened them in front of the camera. I'm gonna share this video in our next training. And inside, they were exactly the same. So basically, they just used that plasma pen, turn it to a more expensive device. But the thing is, we tested all of those, and they are low frequency, basically electrocautery device. Now, what is the difference? The difference is the low frequency electrocautery device does not ionize the nitrogen. So you don't have any plasma because it doesn't have the intensity, the power to do it. So you are burning the tissue using electricity. And that's why you hear about all the side effects and problems and fat necrosis and lung healing and burn and scars that comes from plasma pen. Now, so this is one category of basically fake plasma. And they are using the name plasma because basically plasma was very successful. Dr. Croley, you always say that plasma is the future. And that's why people want to, to jump into this market and use the name plasma. Now,
Yeah.
go ahead.
I just want to jump in there because, Arash, you will remember I was very reluctant to even try the Plexr. And
Yes.
so we can talk a little bit about the Actifil line of products that we use with this to really optimize the results. And that's really was my first introduction to your company. I was using that product with microneedling. But in reality, I was really reluctant to even try the Plexr because of the complications I had managed from so-called plasma pens. And so they're pretty much sold unregulated, and all over the US, but especially in kind of our area. There had been a lot of unlicensed, not, they may be licensed in other specialties. They were not licensed medical providers that were doing treatments with a variety of these devices. And some of them I talked to, and they had paid around $1,000 for the device. And again, they were burning patients. They were long recovery times. And what we were seeing in our clinic was the patients that were showing up with the PIH, or the post-inflammatory hyperpigmentation, or these dark spots that were on their skin for like months and months afterwards. And so I was like, no, I'm not going to use a device like that because of all the complications. And that at that point in time, that was my lack of understanding about the plasma device, about the Plexr and how it's different. And, there is a different price point, but it's a lot safer. So from my standpoint, I dealt with the complications of those devices. I was reluctant. And I can tell you that we've had zero long-term complications from the Plexr. So with our most aggressive treatments, we've had patients that have stayed where we can see the marks, but they're not scabbed or not flaking. All that's done within a week or so at most. We've had them where they stay dark for 3 or 4 weeks, but again, relatively speaking, it's a short time. It's not like the ones I was seeing before where it's 6 months later and that you can still see all the little dark marks. But from a consumer perspective, it looks very similar. So when we see the treatments and you see the plasma dots being delivered and you see the marks right immediately after the procedure, it looks similar to what you see with any of these devices that call themselves a plasma pen. And so I think it's really confusing to the patient. And I think it's confusing to healthcare providers who are saying, why is there such a price difference in these devices? And where that confusion is coming in is they don't understand the technology behind how the Plexr is working, how it's generating true plasma to remove this tissue without causing the thermal damage.
Absolutely. Now, the second basically difference is how you generate plasma. Now, for example, I can give you another example. Like, for example, Neogen is also a plasma device. It's a true plasma device, right? And the way that Neogen generates plasma is through radio frequency based on their website. And that's totally okay. You know, you can use radio frequency and generate plasma, which is fun. It's okay. But the difference is then your plasma is mixed with another type of energy. So you have plasma and you have radio frequency. So the problem is that that energy goes deeper into the skin. So you cannot use those type of plasmas, for example, for, let me get to this, you cannot use these type of basically devices for ocular surfaces because they are not safe. Now, they are not safe for ocular surface. They're safe for the skin, but not for the ocular surface. So Plexr is the only device which is able to treat ocular surface. You can remove pterygium, you can remove pinguecula, you can remove conjunctival nevus. And look how Plexr is working on ocular surface for conjunctival chalazion. Now, when you are using the pure plasma, the clean plasma means the plasma that does not have any other sort of energy with itself, then it is Plexr. And for this thing, it is 100% unique. And because of that, you don't have thermal damage. You don't have complications. You don't have basically these problems. And the whole energy is outside of the skin. I think we answered those questions.
Yes, someone wanted to know the difference between Neogen for sure and subnodal, but I guess we really answered this question right now.
Yeah. So we have about 10 more minutes. We can explore the Plexr cat resurfacing for hair grow if you want.
Sure. And you know, if you guys didn't have your questions answered, put them back in there, like just so we can clarify. Hopefully we answer this thoroughly. Yeah, actually, I love this for hair growth. And just this last week, I don't think you even seen it yet, Arash, but we had the videographer come in and we did a Plexr cat resurfacing for hair growth.
Really?
You know, we do the videos in the office, and that was one that we chose to do this past time. So we've been doing Plexr shower and the Plexr cat resurfacing both to improve the transdermal delivery of products. And so we've done that with PRP. We've done that with actually some of the exosomes. And so, you know, from different companies. And so we're looking and trying to compare some of those results. So we did it with some exosomes this past week was the one we were doing. And we combined that with cat resurfacing and an exosome applied topically. And so, you know, when we're doing this, there's a lot of different ways that we can stimulate our, you know, the hair follicles to grow. And, you know, I think many people on this call probably are familiar with stimulating them through a mechanical trauma. So we're doing something like a needling device of some sort, whether it's a stamp or a roller or a mechanical pin, but we're causing some sort of mechanical trauma at the level of the follicle. Through the healing process, we're then wanting to improve angiogenesis or blood supply to that area to nourish the follicle, maybe move some of them from the resting phase into the active growing phase. We know that those techniques can be painful. They're difficult to numb for. It's messy. And so I really liked the idea of having something that I could use that I didn't have to really extensively numb for. It didn't involve injections into the scalp and would get us really superior results. And so what we're doing is, you know, we were first doing the Plexr shower. So I did that before I was doing the cat resurfacing because I thought it was going to be a little bit more difficult to numb for that. And so the shower, we don't really numb at all. And I thought, let me try. That's what we see here. That's
Yeah,
what we see here is on this video is the shower. So for those of you guys who don't have the device or haven't seen it, you notice this is a wider, like a triangle shaped tip. And we're using that, and that's nano ablative, or that's creating using plasma to create these little micro channels where it's opening up those skin cells so we can put a product on and have it delivered more deeply, delivered to the area that we want it to really work at. And so, you know, we can use the red or the green handpiece here to open those pores, and that's what I did for a while. But now I think it's a little bit more aggressive treatment with, theoretically better results. I honestly haven't done enough of these to follow them out at like 6 months yet with a cat resurfacing to know if it's really going to make a huge difference. But hopefully, theoretically it should, and that's what we're doing now. So what you see here is the cat resurfacing. So from this, we're going to use the plasma energy, and this is going to be our semi-ablative form. So we're delivering the energy a little bit more deeply. So it's going to stimulate those follicles more intensely than what we would do with the shower. So regardless of what we put on topically, we should get stimulation of the follicles with just the energy alone. And we're going to improve that even more now by what topical we choose to apply with this. And you could do this with a lot of different products. So, we can certainly recommend or go over with you guys what different ones we've tried and used. But if you're already doing PRP in your practice and PRP for scalps, you could combine this with that. You could combine this with different hair serums. You could even combine this with your topical minoxidils if you wanted to, because you're going to get the stimulation from the plasma energy and the cat resurfacing. And now you're going to be able to combine that with a topical and get better delivery of whatever that topical is that you're using.
the good thing about this case is, as you see here, we didn't use any numbing, and he was not feeling any pain.
And we didn't use numbing. We have not been using numbing for our cat resurfacing either. We normally do on the face. And that was one of the
Yeah,
reasons I
face
was a
uses
little bit
numbing.
reluctant to kind of do it in the scalp, is because of the same problems with microneedling. You get all the numbing in there and it's hard to get it out. So, but they've been fine with it in the scalp without us having to numb.
Yeah, they don't feel it. And also you can use the ablative spot technique for the same purpose, which basically we're going to talk more. And then you can combine it with, as you said, PRP, mesotherapy, other products. The protocols is like 3 to 6 times every 6 to 10 weeks. Now, okay.
Question come up about that?
Yeah, we have another question. Someone wants to know if this was already tried on people who had hair loss due to chemo.
We don't have any experiment for those people because it's a very new technique for hair growth. But the thing is, for example, we use Plexr for like psoriasis. We use Plexr for dermatitis, for eczema. So one of the things that plasma does to the skin is it revives and rejuvenates the skin, you know? So then the mechanism of action of Plexr for hair growth is basically three things: activating angiogenesis and blood circulation, which is the main thing that you want to happen. And then the second one is the biostimulation of the follicle. And the third one is it is antibacterial and fungal. So these three mechanisms of action, they also help for after chemotherapy, but you need to make sure that, because after chemotherapy, the healing power of the body is gone, kind of. So you don't want to use cat resurfacing or ablative. If you want to do something, it's going to be just Plexr shower. Dr. Croley can complete that.
Yeah, so I don't think the thing is, it's not going to, obviously the mechanism of hair loss and chemo, it's not going to reverse that. So you're not going to use that in an active patient undergoing chemo. It's not going to mitigate hair loss from chemo or help that. But when they're completed their round of chemo, that is when we can try to speed up the process. So as their hair is starting to grow back, certainly I would feel comfortable using this technology. No, there's not studies on it. But we've treated post-chemo patients in our practice definitely for a while now with a variety of techniques to support hair growth and to support that process of them growing their hair back. You want to make sure that they definitely are not going to heal wounds normally, right? Their body's ability to do that for a long time after chemo. So somewhere, a minimum of 6 months to a year, that process is going to be impaired and maybe even longer. So hair is a tricky area to treat. And one of the things that I see, regardless of whether you're using injections, topicals, Plexr, micro, any of those things that you're using, if you haven't addressed underlying causes of the hair loss, none of those technologies are necessarily going to be effective. And so when I say that, along with chemo, but you have a lot of other deficiencies. So you can have vitamin deficiencies, you can have abnormalities and different sorts of, your thyroid function, your B12 level, your hormone levels, all of those things will impact your hair. So this is an effective mechanism that I would use to stimulate moving hair from the resting phase and the more active growing phase, and especially after they shed all their hair from chemo. But don't forget all those other things that are going to go into it. We could do a whole session on just hair alone,
Yeah,
because there's a lot of things that factor into that.
there is a how successful is the treatment for patient with
Yeah.
androgenic alopecia?
Yeah, so for androgenic alopecia, so basically a hormone related, it's very effective as long as they haven't fully. So if you have a guy that comes in that's totally bald and has no hair growing there, it doesn't matter what we use, it's not going to simulate hair growth. But if you have patients that come in with like a typical male pattern baldness, or they're on testosterone replacement therapy, we may see it a lot with that, or perimenopausal, females. Then it is very effective to help grow hair in those situations. That being said, it gets back to my original point. You also have to address the underlying cause simultaneously. So if we're having hair loss because of high amounts of DHT or dihydrotestosterone, we're going to have to address that. And so whether you're doing that with an oral finasteride, or if you're using some kind of topical drops, the Plexr is a very effective way to help then stimulate those hair follicles to start growing. But we have to address the underlying cause of that at the same time.
Exactly. So we have another question here. Have you ever experienced a patient post-op surgery, those contact points remain in more than a year? The answer is, I'm working with Plexr for over 12 years, and I never seen anything like that those points basically remains after 1 year. Now,
the longest I've personally seen is 5 weeks.
I would like to add something to this. This happens when people treat patients with plasma pens.
yes.
And that is the confusion again. It does not happen with the Plexr, because the technology here is really something completely different.
Yeah, when you
And I've
use
definitely seen it that long with the ones where they've been treated with and I don't know what the devices are. They just generically refer to plasma pen, and that's a whole host of devices. And for sure, I've seen them prolong that, not that I've treated, but where they've come into practice for me to treat them. And in those cases, we have to use a whole variety of treatment protocols aimed at post-inflammatory hyperpigmentation. So usually that is as the term implies, it's a post-inflammatory condition. So anything you do that's inflammatory can prolong that process. So we're usually wanting to use things that are, going to be minimally inflammatory, if at all. So there's a few different devices that we can use in our practice, or topicals that we can use, but in general, we don't want to do anything super aggressive or pigment in that area, because now we can worsen it and prolong the process even longer.
Yeah, and I just want to add that the reason why those happens with plasma pen is that plasma pen is using electricity, and electricity is something that penetrates to the body. And when it goes deep, it causes deep fat necrosis. So because of that fat necrosis, you see a scar. It's like it's similar to acne scar. It's deep, and then you have to wait for months, and then sometimes that fat is totally necrosed, and you cannot recover from it.
But even not from the fat necrosis is a whole separate problem. But I think it's probably some from the melanocyte stimulation as well, because
Yeah,
I've seen just
yeah,
the dark spots
yeah.
from those where they stimulate it, and then they get inflammation and permanent discoloration, or long-term, I should say permanent, but long-term discoloration of that.
No, because the question was
Mhm.
talking about the scars. That's why I brought that.
Yeah. No, I think it's a good point. It's just that I've seen the dark. So to me, that's why the kind of knockoff devices, or the ones that you don't know the energy, or using electrocautery, are very dangerous, and they shouldn't be confused with this at all.
Exactly. Now, my last point is, I always say, if you are a doctor or nurse and you are in medical business, then your most important value, and Chris, correct me if I'm wrong, your most important value is your credibility. And you don't want to waste and use and consume your credibility to justify the side effect of a technology. You actually want to use a technology which has a basically global satisfaction and credit, and take credit from that, not the other way. So when people ask, like, for example, it's funny because I was looking to some of these new Chinese car, if you go to Instagram, you find lots of fun Chinese car, and they have all the options. And I was thinking, then what is the difference? Why people still are so basically interested to good brands? And the answer is, it's not about just the car. It's about the history. It's about the safety. It's about all the service. It's not just one thing. So when it comes to basically technology, is the same thing. For example, if you want to buy a hair removal machine, of course, you go for example, I don't know, Apogee or Gentlaze, or these devices which they have been in the market forever, or one of the cynosure hair removal lasers. So that's how you can make sure that you are going toward the right direction in terms of technology.